Hi, I am Dr. Subhash speaking. I am a pediatrician practicing near Mahalakshmi layout. I practice in Sanjeevini hospital. Thank you. Hi. Hemophilia is basically a bleeding disorder. Okay, let us go down to the basics a bit. It's a bleeding disorder where it can be detected after 1 year or 2 years of age. Early neonate or a newborn baby, it's difficult to diagnose. It's detected usually after 1 or 2 years of age, where even a small bleed, it goes on bleeding. Usually the bleed should stop by 5 minutes. Max is 8 minutes. That is a clotting time. It doesn't happen here. It starts bleeding. Our blood has got coagulation factors. They are called as 13 coagulation factors, which is required for the blood to be remaining as liquid inside the body, and when it comes out to clot, so that we don't leak the blood. This is the actual basic physiology. But due to factor 8 or factor 9 deficiency, you cannot stop the bleeding. The bleed continues. The first sign of early diagnosis or first sign of identification is bleeding in the joints. If the child falls, the joints swells. If there is an injury to the joint swells. It's called as hemarthrosis. There is a first sign we usually see when there is a bleeding joint, and this is where you start working on it and come to the diagnosis of hemophilia. Now, because of the hemophiliac societies formed and a lot of awareness being given for the hemophilia, life expectancy has fairly improved. Before, we used to give factor 8 and factor 9 concentrates. Now we have shifted to cryoprecipitates, though expensive, but you are sure that you don't get blood transfusion or plasma transfusion derived diseases like hepatitis C and hepatitis A or hepatitis B, like that. So cryoprecipitates are doing a big thing here, and life expectancy is fairly good. There's a comprehensive care plan available everywhere, and hemophiliac society is available. They can lead a fairly good life. Here usually the males are affected, the female is the carrier. It's an X-linked disorder. Okay, so expectancy is great. Nothing much to scare about, but yes, if you are undergoing a surgery, if you are undergoing even a tooth extraction, then you have to be pretty careful. You have to check your coagulation levels. How are they? You have to consult your hematologist and then move forward. Life expectancy is great, though lesser than the normal life expectancy. If you go for the comprehensive plan and be in touch with your regular hematologist, that would be great. Thank you.